Good evening, everyone, and thank you for sticking with me for the last presentation of the evening. This evening, it's my pleasure to be speaking to you about what we know of heart disease in the local context here in the Cayman Islands, and what we're doing to further our understanding of that. So let's launch right in. So what do we know here about cardiovascular disease in the Cayman Islands, and what data do we currently have to evidence this? Well, a statistic that you've probably heard before and likely will hear during this conference is that of the top 10 causes of mortality in the Cayman Islands as reported in the Compendium of Statistics, cardiovascular disease is the leading cause, attributing to 27% of deaths here. And that statistic is slightly higher in women at 29% and slightly lower in men at 25% of deaths. But to dig slightly more into this, there is also a report that was produced by PAHOS, the Pan American Health Organization, and you will note that the data here is slightly out of date. This is back in 2008, 2010, but they did some analysis on data from the Cayman Islands and reported on the all-cause of deaths, of premature deaths. So these are among individuals aged 30 to 69 years. And as you'll see on the left side, there's one chart for males, and on the right, another chart for females. And what we can see here is that following cancer, in the slightly darker blue colour, cardiovascular disease is the second leading cause of mortality in premature deaths. These are individuals that we'd otherwise expect to be fit and healthy. And looking a little bit more into that, what are the different types of cardiovascular disease that are causing these deaths? Again, similar makeup of the graphs. On the left, you've got males, and there are only 20 deaths that are included in this chart, so just note that these are quite small numbers. And on the right, females with 16 deaths being represented. And if you look, you can see there in the large red section that ischemic heart disease is the main contributor to premature deaths among males, followed by hypertensive disease in orange, and a very similar picture among females as well. And as you all know, modifiable risk factors can have a big impact if an individual is able to change their behaviour and remove some of these risk factors from their life, then they can reduce the chance of developing both ischemic heart disease and hypertension diseases. The other form of information that we do have based here in the Cayman Islands is from the STEP survey that was run in 2012, and this is about the prevalence of raised blood pressure on the island. The survey found that 26% of the population had raised blood pressure and were currently receiving medication for that, and a further 16% of the population had raised blood pressure but weren't currently on medication at the time. And as you all know, raised blood pressure is a precursor for those hypertensive diseases that we were looking at on the previous chart. So this is somewhere that we know we can start at looking at risk factors that we have and how we can look to reduce them in the population. So there's not a lot there, and what you probably did pick up is quite a lot of it is out of date. So what do we know currently of recent data here in the Cayman Islands? And I'm sure it won't be a surprise to you that we do have quite a few gaps and quite a few questions that we don't currently have the data to go alongside. So we don't know what the prevalence or incidence of cardiovascular disease is here currently, nor which types of cardiovascular disease is occurring and at what scale. We don't have data on the causes of premature mortality or anything updated from what I was able to show you. And we don't have information looking at the age of onset of these diseases or being able to look at age-adjusted mortality rates. Apart from the STEP survey in 2012, we've not had anything more recently looking at the prevalence of risk factors for non-communicable diseases generally, but also for cardiovascular disease. We have very little information looking at individuals' access to healthcare, particularly in the area of heart disease, and whether they might be receiving treatment or getting preventative care to look to prevent these diseases from progressing. So as you can see, quite a few gaps and quite a few questions. So can we look to information from the Caribbean region that maybe can help give us some insights of what might be true for what's happening here in the Cayman Islands. While looking to the Global Burden of Disease study, they released some information from 2021, and this report didn't have any information from the Cayman Islands in it, but it's pulled from a number of different countries across the Caribbean. And the age-standardized mortality rates that were presented in this report range from 102 to 480 deaths per 100,000 population. And to put that into context a bit for you, if we compare this to the UK, the same statistic, the age-standardized mortality rate for England in the same year was 230 deaths per 100,000, and in the US it was actually lower at 128 deaths. So you can see a few countries in the Caribbean will be falling below this, but many are above. The report also showed that the highest cause of disability-adjusted life years, DALYs, was ischemic heart disease, followed by stroke, and then followed by hypertensive heart disease. And as we've heard already today, these are all conditions that have a very big impact on people's lives and a big impact on their quality of life. And thinking about the different risks for cardiovascular disease, high systolic blood pressure accounted for the largest proportion of DALYs in the Caribbean region at 47%. So that gives you some information from the Caribbean region, but again, it doesn't tell us everything. And what can we learn from looking a bit further afield at the global picture? You've already heard a lot of statistics this evening and this afternoon and charts from around the world, but there are two things in particular that I want to pull out from the Global Burden of Disease study. And that is, first of all, that whilst we are seeing a good sign globally that cardiovascular disease incidence is decreasing, which is a great thing and is thought to be linked to people understanding more about how they can change their behaviours and their lifestyles, there is, partly due to demographic changes, an increase in the global population and an increase in, particularly in the ageing population, the raw number of cardiovascular deaths and cases are increasing globally. So whilst we're seeing a good change in the trends, when you actually look at the raw numbers and think about the burden that that brings to healthcare, the numbers of cases and deaths are increasing. And then thinking about, well, where do we want to focus our attention to preventing these diseases from occurring in the first place? The Global Burden of Disease study looks a lot at different risk factors, and you'll see on the right of this slide, you've got a comparison from 1990 to 2019, and it ranks the different risk factors and how much they contribute to cardiovascular disease occurring. And you'll see at the top of the top three, they've not changed in rank in the last 20 years. And it reinforces what we know, that high systolic blood pressure, diet, and high LDL cholesterol are key drivers where we can be focusing our attention to try and improve prevention of these diseases. So we've established that there's a lot that we don't know data-wise in Cayman, and what can we be doing about that moving forwards? How can we change that? Well, I'm pleased to say we currently are investing a lot in this area. We have the STEP survey, which is happening right now. It's a national health survey, and as I mentioned, it happened previously in 2012. We launched it just a week ago. It's running for the next 2 months, and it's partly why I'm wearing this lovely blue polo top. So if you see people out in the community wearing these, please encourage them. They are our team of enumerators who are out collecting data, doing an excellent job. So please do cheer them on, and if they come to your door, please do give some time to speaking with them about it. But just to explain to you a bit of what the survey is about, it was designed by the World Health Organization to look at the prevalence of non-communicable disease risk factors. And it's got a standardized approach that is used all around the world. And what that means is we can then compare the data between different countries, knowing that the methodology that's been used to collect the data is exactly the same. And for us, seeing as we did it back in 2012, it also means we can compare the data from then to now and see what's changed in our health status over that time. The survey doesn't include everybody in the population. It takes a random sample. So we're approaching 3,300 households in the next 2 months. And the way that that's done randomly will mean that the data is representative of Cayman as a whole. Another source of information that's often used to collect these statistics is from healthcare facilities, which can be really helpful, but that will also introduce a bias of those who maybe don't have access to healthcare or don't come forward for that. So doing it through this sample, we're able to circumnavigate that. So a little bit about what the steps are. It's called the STEP survey basically because there's 3 different stages or 3 different steps. The first one being a questionnaire. So as I mentioned, we have this team of enumerators, and they will approach a household, and if the individual agrees to take part, they'll go through a questionnaire with them which covers many of the risk factors that we're mentioning in this presentation, as well as a bit of information around individuals' history of non-communicable diseases and their access of healthcare. There's also some basic physical measurements, so the enumerator will also take these, and it includes height, weight, blood pressure, waist and hip circumference. And then there's a final step which is done at a separate occasion by a nurse, and this includes a finger prick blood sample which is then tested for blood glucose and blood cholesterol, and it's a fasting measure, so we're doing these appointments early in the morning. So particularly drawing this back to cardiovascular disease, what is the STEP survey going to do for us in this area, and for looking at the data that we have here, how is this going to change what we know and what we can understand going forwards? There are a few questions in the questionnaire which particularly focus on this. There's one area around history of cardiovascular disease, so we ask individuals, have you ever had a heart attack or chest pain from heart disease? And we also ask whether they've ever had a stroke. So using the answers to those questions, we're then able to understand the prevalence in the population of individuals who've ever suffered from a heart attack or from a stroke. We also go on to ask them about medication. So we ask whether they're currently taking aspirin or statins to prevent or treat heart disease. And again, both of these will enable us at a national level to understand the prevalence of individuals who do have a history of cardiovascular disease and are then on medication relating to that. And additionally, we also ask around history of hypertension. So there's a few different questions here. One about whether an individual's had their blood pressure measured, whether they've been then told by a doctor that they have raised blood pressure or hypertension, and what the time frame of this was, whether it was in the last year. So from these questions, we can then look to understand about the proportion of the population that are having their blood pressure checked, those that report that they've been diagnosed by a doctor to have raised blood pressure or hypertension, and whether this was in the last year, which can help us understand the self-reported incidence of hypertension. So as I mentioned, to go alongside the questionnaire, we also collect some physical measurements, and one of those is blood pressure. As you'll appreciate with questionnaires, these are self-reported, so they are subject to respondent bias. So by taking some of these objective measures, we're able to put that alongside the data and have a bit more of a holistic understanding of the individual's health. So we take 3 measures for blood pressure and use the average of those measures. And by combining this with the questionnaire data, we can understand maybe that there's a proportion of the population who may have raised blood pressure and either be unaware or not be taking medication. And those are 2 really key actionable areas where we can look to improve our public health interventions and our programs to reach people that need it and make sure that people have the right access that they need. And as I mentioned, the survey as a whole is very focused on understanding the prevalence of risk factors for non-communicable diseases. This is really what it's designed around. And many of those also relate to cardiovascular disease. So just to talk you through some of the risk factors that we include in the survey, there are behavioural risk factors such as alcohol use, tobacco use, physical activity and also inactivity, questions relating to diet, so looking at consumption of fruit and vegetables, but also quite a big section is looking around salt intake. And then we also have other risk factors including obesity, as I mentioned, blood pressure, raised blood pressure, and also raised cholesterol. So we're really excited to be running this survey, to be gathering data that is going to be representative of Cayman as a whole, and to be starting to fill some of those gaps that we have in our understanding here in Cayman. And I'm just going to end by playing a short infomercial video which features Honorary Minister Sabrina Turner and also our Chief Medical Officer, Dr. Nick Gent, speaking a little bit about why this survey is so important and what it's going to mean for us going forwards in being able to improve access in the population to healthcare.
The STEPS 2023 National Health Survey is a tangible output from my core ministerial team to address the lack of key data and pertinent local statistics of a public health nature. The data from STEPS will allow us to determine the national prevalence as well as the risk factors for non-communicable diseases within the Cayman Islands.
Non-communicable diseases, or NCDs, are diseases which are not caused typically by acute infection or passed from person to person, as infectious diseases are. Whilst there are genetic factors associated with NCDs, these diseases are usually linked to lifestyle choices and behaviours. Globally, non-communicable diseases like cardiovascular disease, cancer, diabetes, and chronic lung disease are the leading cause of mortality and disability. These conditions require long-term care and treatment, severely impacting an individual's quality of life.
We know that heart disease, cancer, diabetes, and respiratory illnesses are responsible for the majority of deaths within our island every year. But to date, we still do not know the true impact of non-communicable diseases within our shores. The cost of not knowing is simply too high, and one which I know we are all unwilling to keep paying.
In 2012, the Ministry of Health undertook the STEPS National Health Survey, and those results, albeit outdated, remain our key data source for the national burden of NCDs in the Cayman Islands. The STEPS 2012 survey found that 41% of the population had raised blood pressure, and 37% of the population were obese, with an additional 33% of the population being overweight. While STEPS 2012 provided us with valuable data, there are still gaps that we must rectify. For example, we do not currently have the scale for high blood sugar in Cayman.
Through repeating the survey, we can see how the population's health has changed in the last decade.
The results from STEPS 2023 National Health Survey will allow us to prepare and plan relevant policies for our people and inform us as we work to update the National Health Policy and Strategic Plan for Healthcare, review and update relevant legislation, and prioritize key areas of prevention and treatment to strengthen our response. Data collected from the STEPS 2023 National Health Survey will shape Cayman's healthcare services for years to come and has the potential to positively impacting generations of Caymanians and residents. Think about it. A data-driven approach to decision-making allows us to focus our resources where they are most needed, prioritizing not only relevant and effective treatment programs, but also prevention and education programming that, where possible, stops these non-communicable diseases from becoming an issue in the first place.
The STEPS 2023 National Health Survey is long overdue, and the results from the survey will give us the opportunity to adopt data-based health policy founded on recent and robust health indicators. This survey will provide insights into the groups within our population currently most impacted by NCDs, allowing us to tailor healthcare interventions to meet their needs. It will also assist us in understanding the current barriers to healthcare, particularly preventative care, and how those barriers can be mitigated.
We are doing our part, but we cannot do it alone. The quality of the data we collect is based entirely on community participation. Will you help shape Cayman's healthcare?
Thank you very much.